Happy New Year. It's Steve Hoffert.
And I'm Fred Emmett.
And we're the Food Pharmacists. Today we're going to talk about a topic that was brought to us today by one of our viewers on YouTube about thyroid and hypothyroidism. So just briefly, we want to go in today about the basics of what the thyroid organ is, what it produces, and how it affects our body. So just briefly, Fred, tell me a little bit about what is thyroid.
Thyroid is the hormone, are hormones that are made by the thyroid gland. T3 and T4 are the primary components, but there may be others that play a role in energy regulation.
Very good. Now, if you say the thyroid, where is the thyroid gland at, Fred?
It's located about right here.
It's like kind of the shape of like a butterfly, sounds like? Okay, as far as that goes. And so basically you just mentioned two main things. There's T3 and T4. So basically when you look at thyroid, the two functions are T4 is a storage form of thyroid, which basically floats around in our body, which when we think in terms of thyroid replacement is what most doctors give in the form of levothyroxine.
Correct.
The other aspect of it is T3, which is the active form of thyroid, which basically is the heavy lifter in the process of basically working with our bodies and helping the thyroid function and what its important roles are. Just basically, if somebody's low in thyroid, Fred, most commonly when you see patients, what do you typically see symptoms of?
They feel tired a lot. Their chief complaint is, I feel tired all the time. They may complain of hair loss. They may complain of constipation or bowel problems, are the most common complaints that I hear when I look at their thyroid function.
Very good. And you know, some things that you may just actually notice, I mean, visible things are, you know, effects on hair and nail may have a lot of hair loss. You can have hair issues. You may notice brittle, crumbly nails. Weight gain, another thing. One thing you can sometimes see is the outer 1/3 of their eyebrows may be missing. Lots of times who have severe thyroid issues, you may notice like puffy eyeballs, puffy face. Those are just a few of the things that we typically see. But like Fred said, one great thing about thyroid is there are some very good lab work we can get to get some common issues to see, hey, what are some of the problems that we have with thyroid? And you know, when we look at thyroid, we like to look at something called the TSH, which is like the signaling form of the thyroid, which is really one of those goofy things where if the TSH is high, your thyroid is low, and if your TSH is low, your thyroid is high. We also, like we talked about, looking at T3 and T4 levels. We like to look at total T4, free T4, free T3, and something called thyroid antibodies. Now, it's kind of weird to think, but if our body makes thyroid, why would we make antibodies to attack our own thyroid? And that's something Fred has a little bit of expertise on. So Fred, tell me a little bit about thyroid antibodies and why we would check that.
Well, the most common food that we see, here again I'm going to beat the drum on gluten. Gluten dysregulates the thyroid function. Your body produces these antibodies to the gluten that also attack the thyroid, and you tend to see what a condition called hypothyroidism or low thyroid. And what my experience, though, if the thyroid is damaged by these antibodies, it's like cutting off a finger. It doesn't tend to grow back. Thyroid function doesn't tend to improve once the thyroid has been damaged by these antibodies. Right. At least that's my experience.
No, and that's good. And you know, and the other food I know that's had a big impact on thyroid function, there's been a lot in the news about it lately, and its effect actually more on iodine, is the absorption of iodine, is soy. Soy has been shown to be really detrimental with regard to thyroid function too. So we've talked about kind of some food items that can cause some issues with thyroid. The other thing we talked about is too, like the blood work. And one thing too we hear a lot is that, you know, all my blood work looks normal, but I have low thyroid issues. And that kind of plays into looking at total thyroid and not just looking at a TSH, which typically done. You really got to go to the heart of the matter and make sure the body's converting and making the active form of the thyroid. And so that's what's important to look at. So when we have a doctor that looks at, I would highly recommend to have a full thyroid panel done versus just looking at TSH. So we talked about the antibody aspect of it. And so the last thing that we kind of want to talk about is maybe some supplements or nutritional type things that people can do to help with thyroid. And one thing is iodine.
Yeah. Steve, I heard Steve explain to a patient about using a house, building a house as an analogy. You can have the workers present to build a house, but if the materials don't show up, you're not going to be able to build. And having adequate protein, one of the components of thyroid is an amino acid and iodine, and those two, the amino acid, tyrosine,
Yes.
tyrosine and iodine make T4 and T3. So if you're lacking in eating a low protein diet and you don't have iodine, and many of us, where do you get iodine in the diet, Steve?
Well, probably one of the most common places is from the sea. Most iodine that we consume in our diets typically come from basically either eating things like diets high in seafood, also to things like kelp. That's why, like in our United States, we typically see issues with a lot of people with insufficient iodine levels because we don't eat diets that consume a lot of seafood or seaweed as far as that goes. So you can either do things like do iodinized salt, which is one thing. You hear all the monikers about salt. And probably if you're going to do salt, I would recommend to get an iodinized sea salt if you're going to do something like that. You can increase your kelp. Maybe try to eat seafood once or twice a week in your diet. That's another aspect. Or you can actually take iodine supplementation, which is another thing. And with that said, we want to make sure we don't over-iodinize, or then we can actually cause hyper or high thyroid issues. So we have to be careful with that. But iodine supplementation is important. And to me, that's what I always find unique about thyroid. It does such an important job in our bodies, but it's really super simple. I mean, it's just iodine and tyrosine. But without the proper building blocks, our bodies really can't produce what it has to.
Good. How much iodine do you recommend?
That's a good question. It's kind of funny. We've seen our levels or my recommendations for iodine. I mean, I've seen some low recommendations as low as doing like 500 micrograms a day up to probably about 3 milligrams a day. I'm pretty comfortable with that. Once you start going above that, I'm okay. And there are some patients that need that because we're really finding a lot of people who have fibrocystic breasts, people who have nodules in their thyroid, and other calcifications, maybe in their uterus and things like that, can be low in iodine, and some of those patients maybe need higher levels, and that's something we would recommend you actually work with and see your doctor with. But anywhere between, I would say, 500 micrograms to, say, 3 milligrams a day is what I would kind of recommend.
I've heard a comment about bromide.
Bromide, that's a good point. We look at things, iodine is the building block, but there are things we do in our everyday life which are competitors. One is bromide. And bromide's found in a lot of fire retardant type products, and it's things like our steering wheels or clothes that we put on. And believe it or not, those things get absorbed to our body. Matter of fact, there are some people who supplement iodine just by rubbing it on their skin because it gets absorbed so well. So when we do things in our everyday life that competes with iodine, like fire retardant clothes or bromine, or you do a lot of gluten that's been, basically brominated flours. Drinking water, if you're on city water, fluoride. Not so much from toothpaste, unless you just swallow large amounts of toothpaste, but if you do a lot of fluoride drinking water, it also competes with iodine. So those are all things that work against what we're trying to do to make our thyroid work well. And the one thing, too, people forget about is stress. Stress plays a large impact on our body's ability to convert the inactive T4 to the active T3. And it really almost shuts down that system under periods of high stress. So it's important to control stress, and we've talked about that before, about things to do to control stress, but that also plays a big impact.
Let me go back up track a little bit. You mentioned about bromide. I have so many patients tell me, I'm allergic to iodine. What do you think might be really happening when they have that iodine reaction in their food?
Well, that's a good question. I really think it's something else other than the iodine. We have to have iodine in our system. It's a fact as far as it goes. But whether it be, somebody say, well, I put on iodine and I broke out on my skin, for instance. I really think it may be more related to those products actually have other chemicals, actual drug chemical structures in there that can cause reactions versus iodine itself. And I really think it's more related to that as far as it goes. And it may be those people, too, that we talked about who have gut issues that have really hypersensitive immune systems related to that. So, and just a couple other things as far as helping your thyroid function. You want to look at things like magnesium. You want to look at things like copper. It's very important to look at things, something like ferritin, which is iron. Iron plays a big impact on thyroid function as far as that goes. The B vitamins are important, vitamin A. Those are just some things that we like to look at because we talk about supplementation, and that's really important.
What about selenium?
Selenium is also important, too. I think there's some really good studies out to show patients who are low in selenium have thyroid issues, too. But, there's so much to thyroid. And this is another topic. We may get into some more issues, but I know it's a big one because I think it's estimated right now 1 out of every 8 women at some point will be treated for hypothyroidism, low thyroid. So.
Well, good.
Very good. Well, I appreciate it. Like you said, I appreciate the topic. That was a topic that was asked to have us discuss, and we would, in the future, hope you would bring more topics to us because we really like to enjoy the ones or discuss the things that you want to hear from. But it's like you said, in the future, if you need to reach me, my email is steveh@magnoliapharmacy.com.
And I'm fredE@magnoliapharmacy.com. We'd like to wish you all a very happy New Year.
Thank you very much. Have a great day.
Thank you.